Hello. Today we're going to be talking about alternative feeding methods for the breastfed baby. So, as a part of this video, we'll be talking about cup feeding, syringe feeding, and the supplemental nursing system, or SNS as it's commonly known. So what are the indications for alternative feeding methods for the breastfed baby? Well, if mom has an insufficient milk supply, then she can express breast milk, or we can use formula if she doesn't have enough milk, and then we can give it to baby that way. And instead of using a bottle, which can cause nipple confusion, we're going to use alternative methods which will not cause nipple confusion. So when a nipple is put into the mouth, the baby is actually using different muscles than what they use with breastfeeding. So then the more they use a bottle, the more they're developing the muscles that are used for bottle feeding. So we really want to encourage this baby to breastfeed as much as possible. The other time that you might be using this is anytime the doctor orders supplementation. So if mom wants to breastfeed, our first line of action should be going to cup feeding, syringe feeding, or SNS before we just give a bottle. So how do we obtain express breast milk and how do we store it? Well, every mom should be taught hand expression within 6 hours after delivery. Now, this is especially important for our C-section patients because they're separated from baby at the time of delivery when they go to the recovery room. Ideally, we want to be doing skin to skin for the entire time they're in the recovery room so that we can facilitate this breastfeeding relationship. So, how are we going to store the milk? Well, if mom expresses and intends to feed the baby within 4 hours, she can just keep it at her bedside at room temperature. However, if she expressed a lot and doesn't intend to feed this to baby within the next 4 hours, it should be dated and timed along with a patient's sticker to label it so that we can put it into the fridge. Now, when mom does decide to use this express breast milk, it is a 2-nurse double check to remove the breast milk from the fridge. So always make sure you're doing your 2-nurse check. Now, it's very important when you are doing supplementation not to mix express breast milk and formula in the same container because formula has fat that adheres to the container, and then that helps the fat from the breast milk adhere to it. So baby's not actually getting all of the fat that it should. So first give express breast milk and then give formula. And it's also important to note that anytime you do a supplemental feeding, such as cup feeding, syringe, or SNS, that mom should be hand expressing or pumping at the same time to help build that milk supply. So how are we going to do hand expression? So it's very important, as mentioned earlier, to teach within 6 hours after delivery. And so what we're going to do is encourage the patient to wash her hands first. And we have this breast model that I'm going to demonstrate on. So what the patient can do, and you can use this model to show the patient as well, is they're going to roll their fingers in and gently press. And then they're going to go around the entire breast, emptying it. Now, it may take up to 20 to 30 minutes to empty the entire breast. So this does take a bit of work on the patient's part, but it'll really help their milk supply. There is another method for expressing breast milk, and the mom can put her finger on the top of her breast and then cups the breast with her hand. And then she slowly rolls her fingers in, and that will express breast milk. Now, we'll express it into this cup, and then it can be put into a sterile container if it needs to go into the fridge, or it can simply be left at the bedside in a sterile container covered if mom intends to feed within 4 hours. So what are some other benefits to hand expression other than obviously getting some milk for baby? Well, it'll soften the areola, making it easier for baby to latch on. If we do it during breastfeeding, then this will help the milk transfer and baby will actually get more milk. It can also be done during pumping if the mom wants to increase her milk supply. Additionally, hand expression is recommended if the nipples are sore or macerated and they just are too sore to get baby on. They still need to maintain their milk supply, so they should be hand expressing every 2 to 3 hours. In addition to hand expression, after 24 hours after birth, you can also give the mom a pump. You don't want to give before 24 hours though, because otherwise the mom's at risk of having an oversupply of breast milk. So wait the 24 hours and simply have her hand express for the first 24 hours. For the pump, you want to make sure you have the tubing and containers for mom to put the breast milk into after, as well as the pump. So ensure that the flange is the correct size for mom's nipples, otherwise it can cause trauma if it's too small, and it can also not be effective at getting enough suction if the flange is too big. We'll go through this in more detail in another video. So once you turn on the pump, then what we recommend is that you start with low suction and faster cycling of the pump. And then once milk release starts to occur, then we can increase the suction and have it sucking less frequently. Additionally, there's a letdown button that women can press when they feel they're let down. Now, it's important to note, though, that the pump is not as effective as baby is in getting out breast milk. So the best thing is always to put baby to breast. So now we'll discuss how to do a cup feed. So the first thing is the amount that you should give. Now, express breast milk, we can give any amount. However, if formula has been ordered or mom has an insufficient milk supply and would like to supplement with some formula, I personally only do 5 or 10 mLs. It's enough to get baby active and looking for food again, and they'll be hungry again within an hour or 2. Meanwhile, if you do their whole TFI, they're going to be full for 3 to 4 hours. So the best thing is just a small amount, so that we keep trying to get this baby onto the breast. So I have my express breast milk in a little cup, and I'm going to hold my baby simply like this, supporting the head and chin, and put the milk up to its lip. Now, baby will smell the milk and start lapping at it. Now, this is something that you can teach parents how to do. So what I recommend is the first time you do it and the parents watch, the second time you help the parents, and the third time you confirm that they know what they're doing, and then they're free to do cup feeding on their own. So now we're going to be discussing syringe feeding. So what supplies do you need for syringe feeding? Well, you need at minimum a 10 ml syringe. You don't want anything smaller than that because it will cause too much pressure on the tubing that we're going to use to feed baby. So we have our express breast milk in a cup, and we're going to have a 5 French OG NG, and we'll also need gloves and tape. So now we're going to get our syringe feed ready. So I'm simply going to draw up my express breast milk, and then I want to get as much bubbles, air out as I can so that baby doesn't get any excess air. And then I'm going to open up my tubing And I'll simply attach it to my syringe. Now you will have to prime your line just so that a couple drops come out. And now we're ready to get mom ready to feed. So we'll get her to put on a glove. I'm of course demonstrating on myself. Now you want to choose a finger in diameter that's the closest to baby-sized mouth. So you can encourage mom to see which finger baby sucks on better. You want ideally not too small because then it's more like a artificial nipple. So we'll say we've checked our baby's mouth and this is the, and all we're going to do is simply tape it around our finger, like so. Now we want to make sure the tip doesn't go beyond the tip of our finger so that baby doesn't suck just on the tubing. So then we'll get ready to feed our baby. Okay, so now we have baby. We want to make sure baby's either sitting up or in a semi-reclined position. And what we're going to do is we're going to put our finger into baby's mouth along with the tubing. Now this is a little hard, obviously, because we have a mannequin. A lot easier with a new baby. And we're going to wait for baby to start sucking. Our syringe is going to be held up like this so that the fat from the breast milk rises to the top and baby gets that fat first. So baby will start sucking and we'll just slowly, after each suck, give a little bolus until baby starts sucking quite vigorously. At that point in time, baby might actually pull the contents of the syringe out on its own, or you may need to give a little bit of bolus still. Once they're sucking vigorously, you want it to be every 2 to 3 sucks that you're giving a little bolus to stimulate or simulate what the breast is like. Finally, we'll discuss supplemental nursing systems, or SNS as is commonly known. So what we're going to do is it's the same setup that we used for our syringe feed. So we have our 5 French feeding tube and a 10 ml syringe hooked up. And the only difference between this and syringe feeding is where baby latches on. While baby latched onto my finger earlier, here we're going to have baby hooked up or latched on to mom. So baby can actually get some breast milk from mom in addition to having the bonding time. Now, as same with the syringe feeding, you don't want the tube to extend beyond the areola, which mine kind of is, so I'm going to pull it back a little. There we go. So you want to make sure when you're doing SNS that baby gets both the nipple, areola, a large amount, and the tube in its mouth. If baby starts sucking on just the tube, you want to take baby off and then relatch. And then simply, same thing as with your syringe feed. For express breast milk, put it up top so that it can, the breast milk fat can rise to the top. And then we'll just slowly do, with every suck, we'll do a little bolus until baby's sucking vigorously. And then we can do every 2 to 3 sucks.